Hello, good afternoon, everyone. My name is Erica Sandoval, and I'm your host with Home Care to Go. We have an excellent guest today with Savior Doula Services. I'm the CEO of Lone Star Visiting Physicians. We are located in the medical center area, servicing clients as a visiting physician practice from Austin throughout San Antonio down into the Eagle Pass area. If you would like information on our services, please contact us at 210 390 6911. First and foremost, I would like to thank Home Care to Go for establishing this platform for the San Antonio and Austin area to bring awareness to our community regarding local healthcare business, resources, and education by local experts. You can watch us live on Facebook, YouTube, Periscope, on Home Care to Go's website, and follow us on social media to get live updates of our live discussions. If you are interested in speaking with us to highlight your company or be a sponsor, please click on the link below and sign up as a speaker or a sponsor. So today's topic is, what is end-of-life doula services? When and how it can help families in need. I would like to introduce Miss Annamarie Adams, founder and owner of Savior Doula Services. If you could, Miss Anna, can you please briefly introduce yourself to our viewers and let us know what your role and mission is with Savior Doula Services?
Hi, thank you for having me. Yes, my name is Annamarie Adams. I'm an end-of-life doula specialist. I have over 20 years of experience working with hospice patients and families. And our big mission for Savior Doula Services is to provide the best support and comfort to any patients and families that are going through their difficult times.
Can you tell us what is an end-of-life doula and what type of care do they provide for clients?
Wonderful question. Yes. So an end-of-life doula is a person trained to care for someone holistically, physically, emotionally, and spiritually. An end-of-life doula recognizes the dying part of the normal process of living. We also focus on quality of life, and we also focus on the dying process. We also support the families and patients as they're going through their time. This also helps reduce burnout and emotional fatigue. We also educate on the stages of dying. We also can answer any questions that they may have as they're going through that process. Events that may happen through that process, we're able to answer those questions for them. We also provide angel vigils. We also offer at-home wakes and funerals and green burials, and also assist with their their living wills and their advanced directives.
Cover a vast area of services
Yes,
for your
ma'am.
clients. So can you tell me, what do you think is the most important role you play in post-acute healthcare?
I think the most important role that we play there is that we are there to fill in the gaps of our medical system. We can help hospice. We fill in the gaps for hospice because hospice is wonderful. And actually, they can't be there 24 hours a day. So this is where the doula would come in to provide that service. We help assist with their education and also to be able to help them get prepared for anything that might be coming later on down the road. So we also offer a companion care services. And so we're there to help fill in little gaps for the families if they need a break to take time off to do whatever they need to do. We're able to come in and fill in that gap as well.
You talked about a lot about working with hospices. Is that the only way a family can seek out your services or care with your company, or can they? Is there different avenues to directly work with your company without currently being active with a hospice agency?
So yes, so there's sometimes patients don't go and sign up for hospice right away, and or may not need the services right away. Maybe they are not at a terminal diagnosis. So we can come in and we can provide our companion services where we're there to help interact with the patient, assist to doctor's appointments, to help them with their grocery shopping, to be there and be that support system there for the family. We can also come in, even if they're not at home, maybe they're in a nursing home or maybe they are in assisted living. We can come in and fill in the gaps there. Maybe the family member is not maybe they're out of state, so they're not able to be there. So we become the eyes and ears for all the different areas of roles that are out there for the patient.
Here. So can you tell us a little bit about the fee for the services? How do people pay for such a service? Does the insurance help cover for this cost and service, or is it all private pay? Can you elaborate a little bit on what the expectations a family should have when they're wanting to provide this service to their loved ones?
Yes, so unfortunately, right now, insurances do not cover our services. So it would strictly be a private pay, or if the person is working with the hospice company, sometimes the hospice will have a doula, contract a doula, and refer them out to the patients. We also get referrals from other services, nursing homes, assisted living. Um, just really even hospitals can refer out our services, but it is a private pay service mostly.
You had mentioned that you work with hospice agencies. You can also work with assisted living or senior living facilities. Why should a hospice agency and or some type of senior living facility or assisted living facility work with you, and what kind of value do you think you could add for their services?
So we provide a lot of value, especially to other services, because as an end of life doula, we work along the side of hospice when they're on hospice or a home health or any facility. We fill in the gaps. So they cannot watch someone 24/7. So we help fill in that gap. So the eyes and ear, we become the eyes and ears for the other companies. We become their eyes and ears. We let them know, maybe if we're working with a hospice patient and the hospice patient family needs some reteaching on medications or reteaching about the process and things, we can let them know that we need them to come back in, send the nurse out again to do some reteaching for that family.
Do you have to adapt your services based on the home setting of the client, whether they are in an actual home residential area or in a facility?
So what happens is, especially now with the time going on, we also offer teledoula services. So we can, if it's a facility that's not allowing anybody in at this time, we can do FaceTime. We have different avenues, FaceTime, messaging that we can offer to be in there, and even if they're at home, because we've had some patients that have been at home and through the COVID situation, and so we can provide teledoula services. So we can talk with them face to face in that room, and be able to offer that support that they might need.
So just similar to the hospitals and how their COVID units are using different type of FaceTime services for their loved ones to still interact with them, you're able to provide that service as well?
Yes, ma'am, we are able to do that. We are able to provide that service.
Great, great. So, and then can you correct me if I'm wrong, but didn't you inform us that you're starting a statewide education program and have plans to grow doula services across the state of Texas?
Yes, ma'am. Yes, ma'am. So we actually do with due to part of what the rapid growth with hospice and the rapid growth with our elder population, to be able to give some extra support out there, we have developed a Texas Doula movement. And so we have students actually from internationally, even in all across the state of the United States. So we cover different topics to prepare them. We go over the end of life process. We go over the disease processes. We also cover pediatrics and postpartum loss. We also even cover getting really deep into PPE and infection control. Um, so we cover a wide range of topics, which is covered within about 12 weeks time frame. We do offer a live session, and then we also have a self practice that's going to be coming through online that will be hitting beginning of the next year. So, but right now we have our live session where we meet once a week for 12 weeks and discuss. And anybody can take this class. We have family members who have once cared for someone and they feel a calling to this and they want to help other people. We even have medical professionals, LVNs, RNs, social workers, bereavement coordinators. So we our curriculum goes through every little step there that kind of covers that wide range. So even if you're someone who maybe is not a medical professional yet, we help give you that platform to the basis to help you get there.
Volunteer system. And can hospices contract with your company to provide this type of education and training to their staff or volunteers?
Yes, so we also do trainings for any company. We can go in, we can do, depending on the type of company and what type of professionals we're working with. If we're working with medical professionals, we do have a one-day training that goes, we just basically condense everything into a one-day training and go through all of the process with them and explaining to them exactly what the doula role is, what we can and can't do as a doula, and assisting them to become certified so they have a better understanding and more tools to help take care of their patients.
I think with the projected growth in hospice over the next 10, 20 years, I think this is going to be an excellent service, and we'll probably see this type of service with more hospices down the road. So I think this is a great opportunity for companies and individuals to start working with you and your company to get the training and education they need in preparation, for the future. So that's great. Are there any other messages you want to share with your viewers and listeners?
You know, death, a lot of people don't like to talk about death, or when it comes to death, it just gets shut off. And so death doesn't need to be a dark subject. We need to talk about it, and we need to show some love and to each other and work together to make this journey be a rememberable journey that is a peaceful journey. And so we can work together to make that happen, and also, educate that it's not a bad thing. We're all going to have to go through this one day or another. And so we need to come together as a team and as professionals to work together to make sure that we help these families, because this is also something, understanding and going through a good process with this. This helps with the bereavement stage for the loved ones. This really comes in and helps that part as well for the families.
Agree with you more. So if anyone has a need for services or would like to contact Ms. Adams regarding additional information, we will list her contact information on the screen. You can go ahead and screenshot it or save that into your contacts for future needs. And her number she can be reached at is 210-721-3422. Thank you very much, Ms. Adams, for joining us today. So in appreciation of Case Management Week, October 11th through the 17th of 2020, we have plans for something special to appreciate our case managers, especially in our South Texas area. So we invite everyone, feel free to reach out to either myself and or Home Care to Go. We would like for you to share with us your plans, and we'll definitely touch base and share our plans with you, what we're going to be doing. If you have any ideas, feedback, or how to show appreciation to your case managers or colleagues, please don't hesitate to contact us. So once again, my name is Erica Sandoval. I'm with Lone Star Visiting Physicians. And should you have any need for services for yourself or any of your patients, please don't hesitate to contact us. We strive to provide the best customer service possible, as well as timely intake and scheduling practices to get your patients the services that they're in need of immediately. Thank you again to Home Care to Go for allowing us this platform and the opportunity to bring awareness to our community regarding local healthcare business and leadership, and with our community, someone that we can definitely trust. We always have very knowledgeable experts on, and we want to make sure that we're answering the questions that the community has. So you can see recorded conversations of this show on Home Care to Go or on our Facebook, YouTube, and Periscope pages. Follow these pages on social media and get notified every time we plan to go live. Thank you again, everyone, and you all be safe. Have a great day.